So the things we really need to look at are staffing patterns. How are we treating these individuals, adhering to the guidelines of the local rules? Also looking at the aerosol patterns that Richard presented. How do we set this up, and what do we do with staff? Client scheduling specific to vulnerability. Do we have people that are more vulnerable come earlier in the day so they're not exposed to as much perhaps residual in the air? And we staff them with more breaks in between, bringing other clients in. Personal protective equipment. In the United States, we are seeing quite a bit of difference as far as what is required, both in public and in therapy areas. Some therapy pools are open, some are not. Some outpatient clinics are open, some are not. We feel fairly strongly that you should have personal protective equipment on the staff. My friend in Greece, Athenia, says she feels that the clear plastic works better for her because clients can see your facial expression. They can see and read your lips for those that may have hearing difficulties. Specific hygiene we've covered, but we need to be sure which staff are dedicated to the cleaning and how often that is done, particularly again with the vulnerable population. Are you able to hear?
Yeah.
Okay. So the aerobic exercise in the aquatic environment is the other question, and I actually wanted to try to send a question to Richard, but I want to go over this a little bit because aerobic exercise in the aquatic environment provides some unique features to address the immune system strengthening and to potentially mediate the presenting COVID-19 complications or impairments. However, we have some issues with that because what I haven't seen in the literature, and perhaps I've missed it, is what happens when we're exercising at 50% or HHR, at 70%, at 75%, and along with that, how far does the virus potentially get projected? What is your ventilation in your pool? What happens at the water-air interface? And the distance the expired air travels to participants and staff. So these are the questions I think we really need to address when we're looking at particularly these individuals that have immune compromise, not just from COVID-19, but because of their presenting diagnosis. They need the pool to progress functionally. Where is that balance on, do we put them in a pool to progress their function, potentially exposing them to more problems? I think we really need to look as a group at how far does the virus project, or droplets for this matter, of expired air when we're exercising at different intensity levels. So my very last slide is this risk-benefit balance, which is really what we do with all of our clinical interventions. We need to decide is what we're providing a benefit, and does that benefit outweigh any of the risk? We now have some very new situations in that we now may be potentially providing more risk. I agree with all the roundtable speakers, though. I'm not so sure that we shouldn't have been more careful with looking at this risk balance more critically all along, because COVID-19 is not the only player in town, and we all know that. So we can stop and take this pause and really look at personal protection, staffing and distancing, scheduling of what clients are coming in as far as their immune compromise or potential immune compromise. And really, is this the best decision at this point in time for this client? Same with the community exercise. Many of our clients go on to go into programs in the community, and is the community set up to think about these same things? So in our shopping in the US, we have 8 to 9 for the senior citizens in the morning. Maybe we do a protected hour or two for individuals with immune compromised systems. For community pools, the same. So not just scheduling for a lap pool swim or scheduling when you can go to the pool, but we make sure those individuals are protected as much as we can with the potential load that's in the air and the water, and Richard addressed that. So that's pretty much my slides. IATF, we did a nice little overview. Those references are provided, and I uploaded that document over the weekend. Thank you for the time. Sorry about the confusion. I've been waiting and I'm not sure why we couldn't show my slides with share slide. Thank you.